Hey, Team BCN, thank you so much for listening to today's podcast episode. Gale Hankins, Patient Experience Manager in the Quality and Compliance Department, joins us today. Gale will be retiring at the end of December, and in today's conversation, we celebrate her and her role, as well as look forward with her to the next season in her life, and even share some of her favorite recipes. Gale, thank you so much for joining us today.
I am honored to be here with you, Heidi.
Well, I am looking forward to our conversation and getting to know a little bit more about you. So, you've been working at Bluegrass Care Navigators for 15 years. How did you get started working here?
Well, it's an interesting story. Eugenia Smither and I had worked together at a health plan before she came. It was Hospice of the Bluegrass at that time. And she called me and said she had a project she'd like for me to work on. And I declined twice. The third time was the charm. So I'm still here.
What has your journey been like since you've been at Bluegrass Care Navigators career-wise?
Well, it was a much smaller organization then when I started, and I was hired as a part-time quality coordinator. And I did things like chart audits and compiled and reported various data for quality, and was just a resource to other people in administration and directors and programs managers. Just a skill set that I had that they didn't need in their role, but they needed help sometimes with things.
Mm-hmm.
So that's where I started, and it has continued to evolve over the years into different things. And I've always joked with Eugenia, and I think in everyone's job description, there's that line that says "other duties as assigned."
Yes.
So I've had a lot of other duties as assigned, and I've always taken them on as here's something new to learn, because you have to continuously learn. You can't just stop and get stale.
That is true. That is very true. Tell me about your role currently.
Currently, my title is Patient Experience Manager, as you said, and that focuses on hospice more than our other lines of business, just because we have more experience things with hospice. I've developed some experience surveys for some of our other lines of business that are in-house, but the hospice one has to be through a vendor. And just managing those give us feedback, both positive and negative, on what we're doing well with our programs and things that maybe we have overlooked at how our patients and their families view us and the services we provide. So it's helpful to be able to have somebody outside the organization say, hey, why do you do this or not do that? To help us improve our services. And that's something that, that gets shared with all our directors and senior managers. That information is reported at QCC each meeting.
Okay.
So you can see what's going on. And as we receive a comment, those are shared. So our positive comments, our hospice directors share those in their staff meetings and post them on the Wall of Excellence, because sometimes families call out a caregiver or a hospice caregiver by name. So they might write in their comments, Heidi Wilcox was the best. We love her. She's an angel. And it's just nice to have those shared publicly in your team meetings. So
Yes, for sure.
yeah, I like for those to be shared. Just it's nice to be recognized for your positive things.
It really, really is. So, as you said, the hospice, because the surveys, we talked in my meet and greet a couple months ago, but the surveys have been a little tricky for me to understand in my newness, and they may be tricky for some of the rest of our team members as well. So, would you talk about those specifically a little bit more?
There are set questions that are included in the hospice surveys. They're set by CMS, and it's a standard list of questions that all hospices use. And you can add a few questions to that. But that gives us feedbacks on a lot of areas of care that we provide. And our in-house surveys are similar. They cannot be exactly the same, but they're similar to ask important questions about the care we provide, just so we know, are we doing well with this? Can you get appointments? Can you talk to people you need to? but a theme that we carry across the entire organization is rating of care and would you recommend us?
Mm-hmm.
Uh, that's something Liz wanted to be carried across so that she could compare different lines of business and make sure we're not doing very well in one and dropping the ball in another.
Mm-hmm. For sure. So now if I understand right, the hospice survey is the only one that is required. What other service lines did you develop surveys for, and why did you think it was important to take it to the next step when there was no requirement to do that?
Well, we've had a survey for extra care that's been telephonic for many years because extra care felt like they needed a survey as well. And palliative has a survey that's mailed, um, and that information comes back, and I've always gotten that information back to me so that I can track it and trend it for them, give them a report each quarter as they do quarterly surveys,
Mhm.
um, so that they have that information. Just it's good to have feedback on what you're doing well and what you're not, so you
Mhm.
can make improvements when you need to.
Absolutely.
And there have been other little surveys here and there that somebody just wants to do a one-time thing. I helped the music program in bereavement set up a little survey because they wanted to know, we've tried this out. How did it go? What was good? What was not so good? So we can figure out how to move forwards.
Mhm.
A little one-off things come up like that from time to time.
So, really, how I think about your role, based on what you said and other people have said, is that you, through these surveys and the other things that you're doing, you help make sure that Bluegrass Care Navigators continues to be who we say we are and who we want to be.
That's a good way to put it because, you always think when you look at yourself, you always think you're doing great. You're the best in the world. Well, maybe you are, and maybe there's a little tarnish on that shine. They polish up, so
Right, right, for sure. Now, you've also been a member and sat on the board, if I understand correctly, on the Kentucky Association for Healthcare Quality. Can you tell me about your role with them?
Yes, I've been involved with them for many, many years, and that's a statewide organization for healthcare quality individuals. I've served as a secretary, I've served as treasurer, I've served as president. So over the course of years, I've had a lot of roles on that board. And it's just a good organization where people in quality roles in different healthcare settings get together to learn. There are programs that are presented on a regular basis, have the ability to talk to each other and say, "Hey, I'm thinking about this. How do you all do that, or do you do that?" It's just a nice organization to have friends across the state that do similar work that may not be exactly the same, but it's a good share ideas organization.
Absolutely. Do you remember when you first became part of that organization?
It was early on. I don't remember. I was hired in 2007, and I don't remember if I started participating then or if it was 2008. It's been a long, long time.
All right. And Eugenia mentioned that you received the Kentucky Association of Healthcare Quality Individual Award. Can you talk about what that award meant to you?
Well, it's a lifetime achievement award, and I was not expecting anything like that, and unfortunately, I didn't get to attend that annual conference because I was sick, but I did send a statement in to say I'm just honored to receive this award, and that's something that's I only in the course of time that I have been in KAHQ, the Kentucky Association for Healthcare Quality. I only recall that award being given one other time.
Oh, wow.
Someone who had been an active board member for many, many years. So it was quite an honor to receive,
Yes.
and it's sitting right here on my desk.
Absolutely, absolutely. What year did you receive that?
It was just this past fall
Oh,
in the
okay. I
yeah,
didn't
the
real
conference. Yeah, that was in September.
Okay, well, congratulations. I didn't realize it was so recent.
Yes.
Oh, that's awesome. How did you see your role on the KAHQ benefiting Bluegrass Care Navigators?
Well, it's like I said, it gave us several of us in the quality and compliance department have been associated with that organization. And being on the board gave us the opportunity to have direct contact friendships, associations with a number of people who are in leadership roles in quality departments, that just to share ideas and say, what do you think about this? Um, we're considering something. How do you do that? Would you suggest it? Would you not? It's just collaboration and friendship that you can't buy.
For sure, for sure. What's been the best part about working at Bluegrass Care Navigators?
I think just being able to use the skills that I have that are a little different from some other people's skills because I am not a clinician. Many people think I'm a nurse. I'm not. I just say I play one at work, and a joke because I've worked in healthcare for so long. I've learned a little bit about healthcare terms, but I just enjoy being able to help my teammates and other people with the things that I can do well. And I'm not saying I can do everything well. Everybody's got some given talents and gifts. And I just have enjoyed using mine with this organization to
Mhm,
say, here's what I can do to help however I can.
mhm. Yes, we all play a part, whether we're clinical or non-clinical. We all have a role to play on the team. So one of the words that has been mentioned several times during my time here, and that's been very short, about 3 months so far, is that people had to be called to spend their life in healthcare. And I think that I'm finding that it applies on the administrative side or the clinical side. How did you know that a career in healthcare was right for you?
Well, I stumbled on a career in healthcare years ago just because I was looking for a job and that was an opening. And I took it and thought, I'm good at what I'm doing, and it's giving me opportunities to learn and grow and give back. And the give back part is, for me, most important to say, I know some things that you don't know, and you know some things that I don't know, and let's share that information and make everything better.
Absolutely. In one of my interviews, it was with Eugenia, to learn a little bit more about you from her perspective. She mentioned that when your father was ill several years ago, that he used a hospice service in another state. How is working for BCN helpful to you as you navigated that difficult season?
It was helpful because I know how hospice is structured and how it works. So I knew how to talk to his nurse, which I talk to her on a regular basis to say, how's he doing? Here's some things that you might need to know about him. And just to know who to call if I had a question or once or twice I had our family had an issue where we needed to change a clinician that my mother didn't click with. Um, just knowing how to do that was very helpful to me because I knew what hospice was is supposed to provide and what they can't provide because of the regulations we follow.
Right, right. And especially being involved in quality and compliance, you have a very good understanding of what it's supposed to be like if it's who we say we are.
Yes.
Yes. What accomplishments in career-wise or maybe outside of your career are you especially proud of?
I think I'm not a proud person to say
I get
I'm
that.
proud of this. I'm more humble than that. But I'm just proud that I could work all these years and offer some assistance and guide other people who are coming behind me who don't have the same experience level and different things at this point in their lives and careers. A quote that I have said many times that I learned from a friend at MD Anderson was he said, you stand on the shoulders of those who came before you. So
Mm,
you have learned from them. And that's something I've always kept to heart because no one person knows everything and is the crux to everything in the world. It's all intertwined. And we just have to guide and help each other. And, there was somebody that knew a lot more before I started that helped me. And in my role here, um, now more than when I first started was, what can I pass on to other people to help them?
That is something that everyone I talk to has mentioned about you, that you were always willing to learn new skills and go above and beyond to get the job done. But you were also someone that they look to as a mentor. And not everybody is that. Like some people can be all about me and just doing their own thing and doing their job very well, but not have that willingness to share with others in that way to help them in their own career. So, why is helping people in their own career especially rewarding for you?
Well, I feel like I said, I'm not all that for the whole organization. We all have to work together because I have worked with people in the past who were so self-centered that they knew something that no one else knew, and they were not willing to share it.
Oh, mhm.
And I kept telling one of my coworkers like that, I said, "If you get hit by a bus, we're up the creek without a paddle." And he just kind of took pride in that, and I thought, "That's just wrong." In
Yes.
my opinion, that's wrong,
Mhm.
because we're here to work together. We're all working towards the same goal.
Absolutely. Absolutely. You not only were willing to help your colleagues out professionally, but you also took time to value them personally by making birthday desserts or, just other things, being a listening ear when they needed to talk. Why was it so important to take care of your colleagues and value them on a personal level as well as a professional one?
Well, I think when you have professional relationships, it goes beyond that. We're all individuals. We all have great things to celebrate in our lives, and we all have struggles, and we need to support one another, however we can. So I'm very happy and willing to be a listening ear, a shoulder to cry on. Let me walk along beside you through this. It's just my personality.
Yeah. One of the things that you mentioned when we met earlier when I first started and that everyone has mentioned about you is your baking skills. When did baking first become a passion for you?
I have baked as long as I can remember,
Really?
even as a child when I had to stand on a chair.
Do you remember the first thing that you learned how to make?
It was my grandmother's yellow cake.
Oh, wow.
I
Do you have what is your favorite thing to make now?
really don't have a favorite. I just enjoy cooking. I enjoy baking. And it's just been my pleasure. You mentioned baking for birthdays for my department. When we were all in the office before COVID hit, we'd have in-person team meetings, and whatever month somebody had a birthday in that month, we celebrated that at the meeting, and I always baked a birthday dessert because I enjoy baking, and it just was a little bit more than going to the bakery and buying something, you know?
For sure. Yeah, I always think homemade is better than store-bought in this instance, especially.
Well, it's just another gift, so to speak, you
Right.
know?
It's the time, it's willing to give of your time to do something kind for somebody else. We talked about this before we started recording, but we just had our Bluegrass Care Navigators holiday potluck, and your peppermint pie was a huge hit. So, would you mind sharing that recipe with us?
I will send it to you, Heidi, and you can share it however you wanna share it.
Okay.
It's not something I came up with. It's a recipe I ran across because 'cause I'm always reading recipes, and I thought, "This sounds good, I'm gonna make it," and I have made it before. And I just thought with that being a Christmas celebration and peppermint's kind of something that's thought about around the holidays, I thought, "I'm just gonna make that peppermint pie," because it wasn't heavy after we all ate way more than we should have for
Yes,
lunch.
I know I did. If people want some of your other recipes, do you have a cookbook that you've compiled of your favorite things?
I don't have a single cookbook. I have many cookbooks, and I have recipes that I pull from different cookbooks that are favorites, and they're just all on a they're all on a shelf, taking up a lot of space.
Well, if you ever decide to compile a list of your favorites, let me know because I would love to purchase that. What are you most looking forward to in your retirement?
I'm looking forward to getting back to some of the things that I just have laid aside because I didn't have time to devote to them. I used to do a lot of crafts, sewing, lots of things like that I just have laid aside because I just haven't had time to devote to them.
Mhm. Well, I hope you get to enjoy this next season, and craft and bake and do whatever your heart desires that brings you joy. Before I let
I am sure I will.
before I let you go, is there anything else you'd like to say that I didn't know to ask you?
Well, I just wish the best for all my friends at Bluegrass Care Navigators and success for the organization because we're here to support people who need our help, and that's what we have to keep in mind, and it will continue long after I have left.
Well, you've put us in a good place from what I understand to continue to do well, so thank you very much for that.
I can just say I've done the best I could with the things that I tried to tackle, and that's not to say I was successful with everything, but I kept plugging and
Yeah.
and I feel like I've done a good job here.
Yes, yes. From being new, I can just go on what other people have told me, but I've heard nothing but good things, so you're much appreciated.
That's a heartwarming way to leave. There's nobody saying, "Don't let the door hit you on your way out."
No. Well, Gail, it has been a pleasure to talk with you today. Thank you so much for your time and for the opportunity to get to know you a little bit better, and congratulations on your upcoming retirement.
Well, thank you on the congratulations, and thank you for taking the time to even wanna have a conversation with me to say, "What have you done in the last almost 16 years?"
Right, right. Well, thank you again.